Do occupational therapists recommend weighted vests? Are you curious about whether occupational therapists recommend weighted vests for children with autism spectrum disorder? Let's break it down together. Occupational therapists sometimes suggest weighted vests as part of therapy, especially for kids who have trouble processing sensory information. These vests are designed to hold small weights, usually around 5 to 10% of the child's body weight. This added weight provides deep pressure input to the muscles and joints. The idea behind using weighted vests is that the pressure they apply feels similar to a firm hug. This sensation can help some children feel calmer and more focused. For kids with autism spectrum disorder, this can be particularly helpful in managing anxiety and improving attention. Occupational therapists see weighted vests as just one tool in a larger toolbox of sensory integration therapy. This therapy aims to help children better manage their sensory experiences. However, it is important to note that weighted vests are not a magic solution. They should be used alongside other sensory strategies that are tailored to each child's unique needs. Research on the effectiveness of weighted vests shows mixed results. Some families and therapists report positive outcomes, like increased calmness and better focus. Yet, scientific studies have found that not all children experience significant improvements. Because of this variability, occupational therapists recommend closely monitoring how each child responds to the vest. Individualized use is key, rather than a one-size-fits-all approach. When it comes to practical guidelines for using weighted vests, there are a few things to keep in mind. The weight of the vest should not exceed 5 to 10% of the child's body weight. This ensures safety and comfort. Wearing the vest is typically limited to short periods, around 20 to 30 minutes. This helps prevent overuse and dependency on the vest. Additionally, children with certain medical conditions, such as respiratory or circulatory issues, should avoid using weighted vests unless a healthcare provider gives the green light. The vest should be part of a broader sensory intervention plan that is designed and supervised by an occupational therapist. In summary, occupational therapists may recommend weighted vests as a helpful tool for some children with autism spectrum disorder. They can assist in managing sensory processing challenges, improving focus, and reducing anxiety. However, their use is highly individualized and should be integrated with other therapeutic strategies for the best support.